Ba-da-da-da-da-da-da. Hey, you dey walk for, you dey pray, you dey push your every day. You dey try your, no be play, but your hustle never pay. And you think say God is not there for your side, and you want to find another way to prosper. You think say God is not just get your time. Àbí ó ti gbàgbé ìlérí t'Olúwa ṣe? Àsìkò ló lákùrẹ́ ta. Ọ̀rọ̀ mi lọ́wọ́, ọ̀rọ̀ mi lọ́wọ́, ọ̀rọ̀ mi lọ́wọ́. Àní ọ̀rọ̀ mi lọ́wọ́ Olúwa, lọ́wọ́ Olúwa. Yeah. You dey wait for your lover, you want to marry. You dey vex your time, gonna go. You dey ask your for bouncing baby. You say, Father, please don't forget your. You think say God in order for your side, and you want to find another way to prosper. And you think say God in order just get your time. Àbí ó ti gbàgbé ìlérí t'Olúwa ṣe? Nobody knows tomorrow. Olúwa. Àìmásìkò ló dààmú ẹ̀dá kan. Ọ̀rọ̀ mi lọ́wọ́, ọ̀rọ̀ mi lọ́wọ́. Àní ọ̀rọ̀ mi lọ́wọ́ Olúwa, lọ́wọ́ Olúwa. Ọ̀rọ̀ mi lọ́wọ́ ni mo máa. Ọ̀rọ̀ mi lọ́wọ́ Olúwa, iṣẹ́ mi ni àbá. Mo ní ọ̀rọ̀ mi lọ́wọ́. Lọ́wọ́ ọlá mi ọwọ́ Olúwa. Ó fi mi ará ilé mi ìfẹ́ ọkọ mi. Àní ọ̀rọ̀ mi lọ́wọ́ Olúwa. Lọ́wọ́ Olúwa. Lọ́wọ́. Waiting be love if you know that. You know that it's really not the same. Oh no, I never thought that I could love anybody the way that I love you so completely. Oh my baby, you are the only liar. You give me joy, and nobody knows me more. Nobody knows me more than you, oh baby. 'Cause I know me wrong. No one can please me more. No one can please me more than you. If I don't get you, it's like the sun without the light. It's like the moon without the night. 'Cause I need you in my life. If I don't get you, it's like faith without belief. Like a heart without a beat. What's a heart without a beat? Waiting be love if you know sure. If you know sure. Like water when on the flow. Oh, I never knew. Say one day now you will go be mine forever. I want you so completely. My baby, oh, you are the family, oh, you make me smile. Nobody loves you more. Nobody loves you more than me, my baby, cause they love me wrong. No one, and no one can please you more. No one can please you more than me. If I don't get you, it's like the sun without the lights. It's like the moon without the night. Because I need you in my life. If I don't get you, it's like faith without belief. Like a heart without a beat. What's a heart without a beat? If I don't get you, it's like the sky without the stars. So, oh, oh, if I don't get you, it's not love for apart. If I don't get you, what's I gonna do?
A very good afternoon, ladies and gentlemen. I would like to request that we kindly take our seats. The lecture is going to commence in a short while. On behalf of Senate, management, staff, and students of the University of Ibadan, I warmly welcome you to the 581st Inaugural Lecture and fourth in the series of inaugural lectures for the 2024-2025 academic session. Today's lecture entitled Earth and Science of Molecules of Health Production, the Labor of a Producer will be delivered by Professor Kayode Osungbade of the Department of Health Policy and Management on behalf of the Faculty of Public Health, College of Medicine. May I warmly inform you that the academic procession will soon file in. And when the academic procession files in, you are expected to please rise and remain standing until the academic procession takes its seat. Also, ladies and gentlemen, you are please expected to rise and remain standing when the national anthem and the University of Ibadan anthem are being rendered. Furthermore, this lecture is being broadcast live on UI Radio, Diamond 101.1 FM. It is also being streamed live on UI websites with the address www.live.ui.edu.ng, as well as on the UI YouTube page at UI Premier TV. Distinguished ladies and gentlemen, inaugural lectures in the University of Ibadan are very significant to our reputation, particularly in the pursuance of excellence in our day-to-day activities. Therefore, we will appreciate your full cooperation throughout the duration of this lecture by observing a solemn atmosphere throughout the lecture. We will also appreciate it if you do not move about during the lecture. Restrooms are on our flanks. Male restroom to my right and female restroom to my left. The Vice Chancellor, Professor Kayode O. Adebowale, MNI FAS, deeply appreciates your presence at this lecture. Thank you, and you are warmly welcome.
The word around town is that you're back in town, and I try not to think about it. I try, but it's been so long, yeah. I thought I moved on, but I without it. I do. I wonder why you even call. It's almost like you're having fun with me. But oh, if I set my eyes on you, it's unavoidable. How come undo? Oh, I thought you were gone for good. And so why do you have to pull me back? Should be you say you won't be coming back. Oh, damn you. This is really bad. Should be you say you were gone for good. Wait till you do wrong, 'cause you knew all along I was being okay without you. You know me, but try to move on, try your party too strong. Can't believe when can't feel without you. Need to be easier. I will come more. It's like you have been fun with me. But so when you set my hands on you, it's unavoidable now. No wonder, oh, I thought you were for good. So I have to pull me back. Should be you there, you won't be coming back. Yeah, this is really bad. Should be you there, you got for good. Tell me why you have to back. Should be you there. You will be hard about. Yeah, you. This is really bad. Should be you there. You go. Tell me why you come back. You. Shame on. You won't make I back. I love you. Tell me why. Say me like that. You won't make I run over you. I will have you there. So you think I can't. You be nice. Now be great. I don't know the girl. Say be nice. Now who's my goodbye to me?
Can we please exit the main entrance and can we please rise as the academic procession files in?
Deputy Vice Chancellor Academic, Registrar, University Librarian, Provost of the College of Medicine and of Uzai College, Dean, Faculty of Public Health, Deans of other faculties and of students, Directors of institutes and centers, Heads of departments, distinguished ladies and gentlemen. The 581st University of Ibadan inaugural lecture will be delivered by Professor Kayode Omoniyi Osungbade of the Department of Health Policy and Management on behalf of the Faculty of Public Health. Professor Kayode Omoniyi Osungbade was born on 8 June 1963 to the family of Mr. Francis Bamidele and Mrs. Marian Oladejo Osungbade, both of blessed memory. He attended Ibadan City Council, ICC Molete, Ibadan, for his primary education from 1970 to 1975, and Methodist High School, Ibadan, for his secondary education from 1975 to 1980. He enrolled into the Higher School Certificate HSC program at the Government College, Ibadan, from 1980 to 1981, and came out as the best student of the year in physics and chemistry. He deserves an applause. Professor Osungbade gained admission into the University of Ibadan in 1981 and graduated with Bachelor of Medicine, Bachelor of Surgery degree in 1987. He undertook his 1-year housemanship with the Oyo State Hospital Management Board. He proceeded on 1-year National Youth Service Corps at Okigwe Local Government, Old Imo State, from 1988 to 1989. He returned to Ibadan in 1989 and worked as a medical officer too, with the Oyo State Hospital Management Board until 1991, when Osun State was created. He moved and transferred his service to Osun State alongside all other Osun State indigenes in October 1991. Opponent of the State Hospital Management Board, in order to commence his residency training in community health at the Obafemi Awolowo University Teaching Hospital, Ile-Ife, on the 1st of March 1992. He moved to the Department of Community Medicine, University College Hospital, Ibadan, on the 1st September 1992 to continue his residency training, which he completed in May 1997. Professor Osungbade joined the service of the University of Ibadan in November 1998 as Lecturer 1. He was appointed an honorary consultant public health physician to the University College Hospital, Ibadan, Nigeria, in 2004. He was appointed the first professor of health policy and management in the university on 1st October 2014. As a senior resident in community health, he served as acting coordinator of studies in Biography program from 1995 to 1998. He was appointed the substantive coordinator of studies in Biography program in 1999 and served in this capacity till 2008. Professor Osungbade was appointed acting head of Department of Community Medicine from 1st August 2008 to 31st August 2010, and took over the mantle of leadership of the new Department of Health Policy and Management from 1st October 2010 to 31st July 2020. He qualifies to be referred to as Emeritus HOD. Professor Osungbade won a 1-year World Health Organization WHO Fellowship on Management of Public Health Trainings in 2003. The fellowship was based at the WHO Center for Vulnerability Reduction, Tunis, in Tunisia. During the period of the fellowship, he participated in development of several training packages for WHO program officers. He also conducted and managed international trainings and workshops for WHO program officers in African countries. He also participated in the packaging and reviewing of 2005 World Health Report of the WHO. Professor Osungbade teaches on the subject of health policy and management, primary healthcare, healthcare financing and economics, communicable tropical disease control, and medical and health research ethics at undergraduate and postgraduate levels. He has supervised 150 master's degree students, supervised and co-supervised 4 PhD students, and 10 fellowship dissertations of both the National Postgraduate Medical College and West African College of Physicians in the specialty of community health, public health, and community medicine. He has served as an external examiner at both undergraduate and postgraduate levels in Nigerian universities, including University of Lagos, Lagos State University, Obafemi Awolowo University, Ile-Ife, University of Ilorin, Olabisi Onabanjo University, Agowe, University of Port Harcourt, University of Calabar, Ibadan University, Benin, and Bowen University Teaching Hospital, Iwo. He has served as a member of the accreditation teams from the academic and professional regulatory bodies, Medical and Dental Council of Nigeria, Nigerian University Commissions, National Postgraduate Medical College of Nigeria, and West Africa College of Physicians. To the following university and teaching hospitals: Ibadan University, Benin, Ambrose Ali University, Ekoma, Irua Specialist Teaching Hospital, Irua, University of Ilorin Teaching Hospital, Ekiti State University Teaching Hospital, Ado-Ekiti, University of Lagos Teaching Hospital, Lagos, Alex Ekweme Federal University Teaching Hospital, Abakaliki, and Jos University Teaching Hospital, Jos. He has been previously appointed as an external assessor for professorial candidates in the University of Lagos, Gombe State University, University of Nigeria, Enugu Campus, University of Port Harcourt, University of Uyo, and Makerere University, Uganda. He is currently an examiner to the National Postgraduate Medical College of Nigeria and West Africa College of Physicians at the membership and fellowship levels. He has served on several national and international expert committees on communicable and non-communicable diseases, namely HIV, malaria, lymphatic filariasis, onchocerciasis, and poliomyelitis. Professor Osungbade had facilitated and participated in many local, national, and international workshops, including communication, mobilization, and behavioral initiatives, COMBI, training at the International Center of Insect Physiology and Ecology, Nairobi, Kenya, in 2004. Teacher-student exchange workshop in Dar es Salaam, Tanzania, in 2007. Health system workshop in Kuopio, Finland, in 2009. And Qatar-sponsored PhD supervisors training in Malawi and South Africa in 2018 and 2020, respectively, to mention a few. He belonged to many research collaborations and groups, which won several research grants from international partners, notably the World AIDS Foundation, Ministry of Foreign Affairs, Finland, Special Program of Research, Development and Research Training in Human Reproduction of the World Health Organization, Geneva, Switzerland, UNIFEM, New York, Malaria Consortium, and Ford Foundation, Nigeria Academy of Science. He has published extensively in local and international peer-reviewed journals and has 70 publications to his credit. Professor Osungbade is a member of academic and professional bodies, notably Association of Public Health Physicians of Nigeria and Nigerian Medical Association. He is a fellow of the National Postgraduate College of Nigeria, Public Health and Medicine, and West African College of Physicians, Community Health. He is the holder of MSc Bioethics, MPhil Public Health, and Doctor of Medicine, MD degrees. He is a fellow of the Nigeria Academy of Medicine. He successfully defended his PhD degree in public health at the Obafemi Awolowo University in December 2024. Within the university, he had served on a number of committees at departments, faculty, and university levels at various times. He is currently the Faculty of Public Health representative on the Central Appointments and Promotions Committee. Professor Kayode Omoniyi Osungbade is happily married to Mrs. Damilola Jumoke Osungbade, and the union is blessed with 3 glorious children, Oluwatomide, Ayomide, and Tiwalade Oluwa. I now invite Professor Kayode Omoniyi Osungbade to deliver his lecture titled Art and Science of Molecules of Earth Production, the Labor of a Producer. Professor Osungbade.
The Vice Chancellor, Deputy Vice Chancellor, Administration, Deputy Vice Chancellor, Academic, Deputy Vice Chancellor, Research, Innovation and Strategic Partnerships, Registrar, Librarian, Provost of the College of Medicine, Provost of the Postgraduate College, Dean of the Faculty of Public Health, Deans of other faculties and of students, Heads of departments, distinguished ladies and gentlemen. I feel highly honored and stand before you today with a profound sense of responsibility to present my inaugural lecture entitled Heart and Science of Molecules of Health Production, the Labor of the Producer. As a professor of Health Policy and Management of the College of Medicine, University of Ibadan, I'm both humbled and excited to share my insights on the intricate and dynamic interplay between human endeavor and the health systems that shape our well-being. I consider it a privilege to be nominated to deliver the 581st Inaugural Lecture of our great University of Ibadan. It is the fourth of the 2024-2025 Inaugural University Lecture Series, the 14th from the Faculty of Public Health, and the first from the Department of Health Policy and Management, which was the highlights of my lecture will chronicle the historical background of the Department of Health Policy and Management, description of the discipline of health policy and management, introduction to the heart and science of molecules of the health production, my labor as a health producer, conclusion and recommendations, historical background of the Department of Health Policy and Management. In 1978, the University Senate approved the establishment of the College of Medicine from the Faculty of Medicine. As part of the collegiate system, the Senate also approved the establishment of the Faculty of Public Health, the departments of which will be created from the existing units in the Department of Preventive and Social Medicine, PSM. During the first phase of development of the Faculty of Public Health, the Institute of Public Health, the Institute of Child Health, and the Department of Human Nutrition were also be part of the approved faculty when established. Thus, as part of the first phase in the evolution of the new Faculty of Public Health, the Department of PSM, which has been at the forefront of teaching, conducting research, and providing service in public health for over 5 decades, evolved into the following three new departments in 2000. Department of Community Medicine with the listed units on the screen. 2, Department of Health Promotion and Education. 3, Department of Epidemiology, Medical Statistics, and Environmental Health. As agreed in 1978, the Institute of Child Health and Development, Department of Human Nutrition also joined the Faculty of Public Health. In the second phase of the evolution, there were plans that these nuclear departments will continue to grow, and the new departments will evolve from them. In April 2010, therefore, the National Universities Commission, NUC, approved the split of the Department of Community Medicine into 2 new departments, Department of Health Policy and Management and Department of Preventive Medicine and Primary Care, which has gone back to the Department of Community Medicine. The Department of Health Policy and Management was inaugurated on 1st August 2010. This is second in Nigeria to the sister Department of Health Administration and Management established at the University of Nigeria Enugu campus in 2008. The 2 members of the academic staff in the Health Policy and Management unit of the Mother Department of Community Medicine, Dr. Aderonke Olumide, now Professor Aderonke Manuel Olumide, and Dr. now Professor Kayode Omoniyi thus became the 2 pioneering academic staff of the new department, and Dr. Olumide served as the pioneer acting head of the department, having worked assiduously for years towards the establishment of the department. The students who had registered in the Department of Community Medicine for public health postgraduate degree programs with specialization in health policy and management, and the master degree programs in health service administration also transferred to the new department. Mr. Vice Chancellor, sir, I'm happy to report that the department has graduated around 20 postgraduate students since inception. These graduates occupy middle and top level positions in tertiary institutions, relevant ministries, and non-government organizations, and contributing to health workforce development and discourse on health policy development and implementation in Nigeria and abroad. Description of the discipline of health policy and management. The health system is an organized network of individuals, institutions, and resources working together to promote, restore, or maintain health. It encompasses all activities aimed at improving the health of a population. This includes a wide range of services from preventive care to treatment and rehabilitation, and the resources needed to deliver them effectively. From the foregoing, the field of health policy and management is a multidisciplinary discipline that bridges the gap between scientific knowledge and practical application within the healthcare system, Frontier et al. 2024. At its core, this specialty focuses on designing, implementing, and evaluating strategies and policies that ensure the effective functioning of healthcare systems. By addressing issues such as resource allocation, service delivery, and health equity, health policy and management aims to optimize the performance of health systems in a way that improves the quality, accessibility, and sustainability of care. Central to this discipline is its emphasis on evidence-based decision-making, which harnesses both quantitative and qualitative research to guide policy formulation and system improvements. In addition, health policy and management draws upon principles of economics, public health, social sciences, and management to address complex healthcare challenges. Buse et al. 2023. This blend of diverse perspectives is essential for fostering collaboration among stakeholders, including governments, healthcare providers, researchers, and the communities they serve. It is a field deeply committed to advancing population health outcomes, especially in the face of global disparities and pressing public health concerns. Introduction to the art and science of molecules of health production. The central theme of this lecture revolves around the vital role of man in health production through system strengthening. Health, as we know, is not merely the absence of disease, but a state of complete physical, mental, and social well-being, WHO 2006. Achieving and maintaining this state requires a concerted effort from all the stakeholders within the health sector, from the frontline healthcare workers and their trainers to policymakers, researchers, and educators. Every group plays a crucial role in the complex machinery that drives health production. Massive et al. 2021. The title of this Health and Science of Molecules of Health Production speaks to the dual nature of healthcare. It is both an art and a science, the harmonious blend of empirical evidence and human compassion. Thus, considering the health systems, its building blocks, training for capacity building the system, research works, health policy making, and implementation of proven and evidence-based health interventions in beneficiary communities are all endeavors that entail the heart and science or science of the heart of the health system. From these dimensions, it can be conveniently concluded that activities in their systems are both heart of the science or science of the heart of their system, depending on the perspective from which individuals choose to view it. The labor of health producer in this context refers to the tireless work and dedication of someone who contributes to the proper function of the health system. It is an acknowledgement of countless hours spent in the virtual and physical spaces of research, training rooms, offices, laboratories, clinics, and policy rooms. Travel hours on land, air, and sea, striving to improve health outcomes for all. My labor as a health producer. Mr. Vice Chancellor, sir, I will discuss my labor as a health producer under the following 4 thematic areas listed on the screen because they are considered as molecules, part of the molecules required for building effective and efficient health systems and ultimately producing health when combined with and without neglecting any of them. My contributions to health service delivery. My research has illuminated the critical determinants of maternal and child health in Nigeria, revealing that unbooked pregnant women face dramatically higher risk of adverse outcomes, including longer labor hours, stillbirth, preterm birth, low birth weight, and poor habeas scores, compared to those who access antenatal care. Osungbade and Ayinde 2011, Osungbade and Ayinde 2014. This underscores the urgent need to promote early and comprehensive prenatal and postnatal care, especially in rural and underserved areas where antenatal service provision remains suboptimal. In the area of infectious diseases, our studies on HIV care found that patients are generally more satisfied with public antiretroviral services than private ones. That is due to concerns among waiting times and quality of care in the private sector. Integrating and enhancing private sector participation, leveraging digital health platforms, and improving service organization are recommended to expand access and elevate the quality of HIV treatment programs, Osungbade et al. 2013, Shau et al. 2013. Systematic reviews of malaria and iron deficiency anemia prevention in pregnancy, preventive strategies for congenital transmission of malaria, and preventive treatments for preeclampsia demonstrated that interventions such as intermittent prevent therapy, insecticide-treated nets, iron supplementation, food fortification, low-dose aspirin, and calcium supplementation are effective, but often hampered by weak health systems, poor service utilization, and sociocultural barriers. Osungbade and Oladoji 2011, Osungbade and Ige 2011, Osungbade and Oladoji 2012. Similarly, our audits of antenatal and intraoperative care at secondary and tertiary facilities revealed significant gaps in the provision and documentation of essential services, including inconsistent monitoring during labor and insufficient attention to immunization, anemia, and malaria prevention. Osungbade et al. 2008, Osungbade et al. 2010, Osungbade et al. 2011, Gbadamosi and Osungbade 2017. Addressing these deficiencies through better training, resource allocation, and strict adherence to clinical protocols is vital for improving birth outcomes. In child health, a systematic review confirmed the effectiveness of preventive treatments for tropical infections and anemia, such as deworming and malaria prophylaxis, but called for strengthened community health systems to maximize impact. Osungbade and Oladoji 2012. Furthermore, our work on school-based urinary cystosomiasis screening validated the use of simple, cost-effective methods like chemical reagent strips, advocating for their tailored implementation in endemic areas. Fatty et al. 2005. Collectively, these findings advocate for comprehensive health system reforms, strengthening infrastructure, improving healthcare worker distribution and training, integrating digital solutions, and scaling up community-based preventive strategies. Such reforms are essential for reducing maternal, child, and infectious disease-related mortality and achieving sustainable improvements in health outcomes across Nigeria. Mr. Vice Chancellor, sir, the most recent National Reproductive Health Policy in Nigeria was revised and launched in 2017 by the Federal Minister of Health. I was engaged as a consultant to lead the entire process from revision to adoption by all the relevant stakeholders. It is gratifying to inform this audience that I was able to use these findings of my studies in shaping the strategic direction of that policy and suggesting intervention packages to address the reported weaknesses. A second opportunity to use our study findings to influence practices came when I led the development of management training packages on integrated management of childhood illnesses, IMCI, and reproductive maternal, newborn, child, adolescent health plus nutrition program. These tools are currently being used to strengthen the capacity of healthcare workers managing maternal and child health programs in Nigeria. Mr. Vice Chancellor, sir, I participated in gender-based violence research. Our interventions with the primary targets on gender-based violence consisted of skills, training, and acquisition workshops. In addition, we developed educational materials, provided microcredit facilities, and conducted income-generating seminars. See that in Table 1. Regarding the secondary targets, we conducted sensitization trainings on gender-based violence and developed and distributed education materials to reduce the incidence of violence. The evaluation of the effectiveness of these multiple interventions showed significant improvement in the knowledge of types of violence, reduction in the reported incidence of rape, and increase in the number of gender-based violence survivors who sought redress following abuse, among others. Figure 1 is showing that. Fawole et al. 2003, Fawole et al. 2005. Mr. Vice Chancellor, sir, our HIV/AIDS and sexual practices related studies among formal and informal workers showed that misconceptions, stigmatization, and risky sexual practices were common. Our evaluation of interventions among these community groups showed significant improvements in the trainers' knowledge of HIV/AIDS, improved HIV knowledge across all target groups and behavioral changes, as shown on table 2. This research underscored the pivotal role of primary healthcare workers in HIV/AIDS prevention efforts in Nigeria. By equipping them with the necessary knowledge and skills, their system can leverage their reach within communities to disseminate vital information and promote safe sexual practices. B, healthcare financing and health economics. Mr. Vice Chancellor, sir, my labor in the field of healthcare financing and health economics has significantly advanced the understanding of the effectiveness analysis of public health interventions, economic burden of diseases, healthcare costs, and expanding access to care and services through social health insurance aimed at improving the universal health coverage in Nigeria. My mechanism treatment study in 2009 demonstrated that community-directed distribution achieved higher coverage, low costs, and greater community satisfaction than mobile approaches, supporting its sustainability for onchocerciasis control, Osungbade 2009. Table 3. As the psoriasis screening study in 2009 identified chemical reagent strips as the most sensitive and cost-effective method for skill-based renal psoriasis detection, informing scalable screening policies, Kayode et al. 2009. Table 4. It shows this. We conducted a road traffic injury cost analysis in 2017 and found catastrophic healthcare expenditures for uninsured patients, underscoring the need for enhanced road safety measures and trauma care financing. Ura et al. 2017. The 2020-22 cardiovascular disease expenditures study found that out-of-pocket payments often push households into poverty, highlighting the urgency of expanding health insurance coverage. Adeniji et al. 2022. We conducted a health expenditure analysis in households in 2015 and showed disproportionate financial burdens on poor households and regional disparities in Nigeria, advocating for reduced out-of-pocket costs and equitable health financing reforms. Osungbade et al. 2015. Our studies on Nigeria's health insurance proposed community-driven prepayment schemes, trust building, and awareness campaigns to expand coverage in informal sectors, addressing NHI's limited reach. Osungbade et al. 2010, Adewale and Osungbade 2016, Adewale et al. 2017. C, my contribution to health workforce development. Mr. Vice Chancellor, sir, my contributions span national and international engagements, focusing on capacity building, curriculum development, and technical advisory roles to support various health initiatives, academic contributions, and research supervision. Since my appointment as Lecturer 1 in 1998, I've been actively involved in undergraduate and postgraduate training at the University of Ibadan, focusing on health services policy and management, health economics, primary health care, communicable tropical disease control, and medical and health research ethics. I've participated in the teaching of more than 50 sets of medical students while undertaking community medicine rotational postings. I've also served as a research supervisor for both undergraduate and postgraduate students, undertaking academic degrees and professional programs. Specifically, I've supervised around 50 master's degree students, supervised and co-supervised 4 PhD students, and 10 fellowship dissertations of both the National Postgraduate Medical College and West African College of Physicians in the specialty of community health, public health, and community medicine. Development of training manuals and capacity building for health workforce. Beyond institutional leadership, I served as a consultant to the National AIDS STI Control Program, NASCAP, under the Federal Ministry of Health, contributing to the development and finalization of training manuals and questionnaires for the National Survey on HIV/AIDS in Nigeria in 2015 and 2018. These resources have been vital in data collection and analysis for HIV surveillance and response strategies in Nigeria. My contributions extended to family planning services, where I co-consulted on the development and finalization of trainers and participants' manuals on long-acting reversible contraceptives, LAC, for community health extension workers in 2015. This activity was part of the efforts to support the task shifting policy of the Nigerian government These manuals have been instrumental not only in enhancing the capacity of frontline healthcare workers, but also expanding the scope of services offered by these healthcare workers, and consequently expanding the coverage in the provision of essential family planning services to communities and reducing gaps in the first needs of family planning users. I also played a key role in the development of the maternal and perinatal death surveillance and response training manual in 2016. This manual serves as a guideline for healthcare providers in identifying, reviewing, and preventing maternal and neonatal deaths in the community and at all levels of healthcare. The manual has not only assisted service providers in the prompt identification and reporting of maternal and perinatal deaths, but also in implementing interventions aimed at preventing future maternal and perinatal deaths. Additionally, I co-developed a training manual on the integration of family planning, reproductive health, and HIV services. This manual has been extensively used to expand the provision of family planning services to people living with HIV/AIDS in HIV clinics. In 2016, the Nigerian Academy of Science engaged me as the lead consultant in developing a training curriculum and manual for secondary school teachers on family life and health education, FLHE, for young persons in Ekiti State, Nigeria. These initiatives not only resulted in the inclusion of FHLE in secondary school education curriculum, but also improved the knowledge and awareness of reproductive health among adolescents and equipped the teachers with the skills and resources necessary for effective delivery of the family life and health education curriculum. When I was on sabbatical and serving as the pioneer director of the Institute of Advanced Clinical Science Education at the University of Medical Sciences, UNIMED, Ondo State in 2021, I led the process of curriculum development for postgraduate degree programs in clinical sciences and medical education. The postgraduate degree program in clinical sciences has attracted a large number of students across Nigeria and West Africa, and is being implemented in partnership between UNIMED, West African College of Surgeons, and West African College of Physicians. This initiative is strengthening the academic research skills and capabilities of medical professionals involved in the training of medical graduates. Later, as an adjunct professor at the UNIMED between 2022 and 2024, I served as the pioneer director of the Center for Health Professions and Medical Education, during which I led the process of establishing a clinical skill laboratory and integrating clinical skill simulation into the curriculum of medical and allied health sciences students. The clinical skill laboratory has provided a great opportunity for the UNIMED students in medical and health sciences regarding hands-on clinical simulation training and learning. The simulation laboratory presently provides basic life support training to first emergency responders from outside the university. I also led a team of educational experts, also UNIMED, in developing online pedagogical training modules for the academic staff and teachers in the health sciences. These modules provide the UNIMED academic staff with modern teaching methodologies aimed at improving their skills of knowledge transfer. Currently, it is a mandatory training for any newly recruited academic staff of UNIMED. The certificate of satisfactory completion is used as part of the assumption of duty documents before placement on the monthly payroll. Thirdly, international contributions to health workforce development. Between 2003 and 2005, during my WHO training fellowship in Tunisia, I participated in the development of several training packages on malaria and tuberculosis and HIV/AIDS, and subsequently deployed these resource materials in conducting and managing international trainings and workshops for WHO country level program officers working on these diseases in Africa. These trainings have strengthened the skills and competence of WHO officers and consequently shaped the African and global efforts on the control or elimination of these diseases. In October 2004, I was at the International Center of Insect Physiology and Ecology, ICIPE, in Kenya, to train Kenyan National Program Officers on communication mobilization and behavioral initiative, COMBI. This was a WHO-driven concept of mobilizing support for country-level programs using the private sector approach. Since 2021 to date, I have been serving as the coordinator of the University of Ibadan on the African Leadership and Management Training for Impact in Malaria Eradication, HALAMINE for short, program in collaboration with Makerere University School of Public Health, Uganda. The training has built the capacity of national and subnational malaria program officers on leadership and program management across a consortium of 11 universities in 9 African countries. You see them, the list of countries in the list of universities in table 5. My contribution regarding leadership and governance for health production. Mr. Vice Chancellor, sir, there's no doubt that galvanizing effective and purposeful leadership and good governance is key to the production of health for the population that we serve. Thus, my contribution to leadership and governance includes high-level advocacy and resource mobilization. I've successfully played these roles while supporting the federal and state government, during which the political leadership and top career administrative and program managers were mobilized to fund public health activities. Thus, all these have contributed immensely to the global and Nigerian efforts on eradication or elimination of endemic diseases. Between 1995 and 2003, our engagement with the local leaders and community on the community-direct treatment with our ivermectin on the onchocerciasis control activities resulted in extensive resource mobilization and increased uptake of our ivermectin, and consequently a drastic reduction in the endemicity level of onchocerciasis and lymphatic filariasis in the communities. I was part of a 2-man mission on this assessment in maternal and child health in northern Liberia in June 2006 that provided the blueprint that was used to design and implement maternal and child health interventions in the early post-war years of Liberia. Back home, hand with my colleagues in the Department of Health Policy and Management, I provided the leadership to the team that developed the University College Hospital Ibadan strategic plan of 2016 to 2020. My community services. Mr. Vice Chancellor, sir, since 2015, I've served as the chairman of the University College Hospital Committee on Response to Emergencies and Outbreak of Diseases. I led the process that resulted in the establishment of disease surveillance units in the institution. And I was appointed to head the unit. In these capacities, and in cooperation with the national and international partners, I contributed to the training of healthcare workers in UCH on disease surveillance, emergency preparedness, and outbreak response. I successfully led outbreak responses due to viral hemorrhagic diseases, and I led the hospital response to COVID-19 pandemic from 2020 to 2022, and served as a member of Oyo State COVID-19 pandemic response team. My work in this area has contributed to strengthening UCH, Oyo State, and Nigeria's capacity to detect, respond to, and mitigate the impact of public health emergencies. I've also contributed to national epidemiological surveys on HIV/AIDS in Nigeria. I've served as an external examiner at both undergraduate and postgraduate levels in Nigerian universities. They are all listed on the screen. I have served as the Medical and Dental Council of Nigeria observer at the final professional MBBS examinations in community medicine, also in Nigeria in Edo State University and Peter Amerodil University of Medical Sciences in Port Harcourt. I have served as a member of the accreditation teams from the academic and professional regulatory bodies to universities and teaching hospitals in Nigeria. They are all listed on the screen. I have served as an external assessor for professorial candidates, also in the listed universities on the screen. Currently, I am an examiner to the National Postgraduate Medical College of Nigeria and the West African College of Physicians at the membership and fellowship levels. I'm a scientific and ethical reviewer for local and international journals, and currently I'm serving as the chairman of the Elector High Institute of Health Research Ethics Committee. Conclusion. Mr. Vice Chancellor, sir, I want to conclude my inaugural lecture with the theory of broken windows. As we see in figure 2 on the screen, the molecules of earth production are interrelated and interdependent. A breakdown in one area cascades into a breakdown in other areas. A dysfunctional molecule, and taken as normal, will consequently lead to other challenges. In view of this, the present state of the molecules of earth production described above had been brought about by neglect of one component or the other. A functional and responsive health system requires a balance in the consideration of the services that the system offers and the expectations of the clients and end users it serves. To this end, the services offered by the system are expected to meet certain minimum standards that guarantee quality, safety, effectiveness, among others, while we strive to meet the user's expectations regarding access to services, coverage, equity, among others. Recommendations. Mr. Vice Chancellor, sir, arising from the experiences shared from my labor as a health producer over the years, the following recommendations are made. 1. A functional and responsive health system is sine qua non to enhancing the health of the population. A balance of all the integral parts of the molecules required to build a resilient health system is needed in sufficient quality and quantity to produce and sustain the health of the population. 2. The myths and misconceptions that remain a barrier to accessing appropriate treatments and other evidence-based interventions by the population that we serve calls for culturally sensitive and context-specific intervention packages. 3. As the political landscape in Nigeria is highly dynamic, continuous engagement of the political class by the health administrators and managers is desirable. 4. There's a need to accelerate the implementation of the relevant sections of the National Health Insurance Act, focusing on increased participation of the informal sector and expand the base of universal health coverage. 5. Health workforce engagement and exposure to emerging state-of-the-art technological advances through on-site and off-site training programs need to be an ongoing exercise. 6. The actors in the public health sector must increasingly subscribe to digital health platforms for provision and payment for services. Acknowledgements. I thank my Creator for His grace given to me to make this day to come to pass. I do not take it for granted. I'm immensely humble and grateful to the God Almighty. I would like to extend my heartfelt gratitude to the leadership of the university, College of Medicine, and University College Hospital, Ibadan. My colleagues, students, and all those who have supported me throughout my academic journey. This inaugural lecture is not only a reflection of my personal achievements, but also a testament to the collective efforts of all those who have contributed to the advancement of health policy and management. I'm deeply honored to share this moment with you and to contribute to the ongoing discourse on health production and health system strengthening. I thank my beloved parents, Mr. Francis Bamidele and Mrs. Miriam Oladejo Osungbade, both of blessed memory, for their investment in my education, despite their limited education. I appreciate the unflinching support received from the large Osungbade family, ably led by the Honorable Justice Adekwele Ojo, near Osungbade, is unavoidably absent today, the Chief Justice of Osun State, and particularly my siblings, Ms. Oluwafemi Osungbade, Ms. Folashade Akintola, Ms. Olajide Osungbade, and Mr. Ayode Osungbade, and their wonderful spouses from my youthful days up to now. I thank you all. You are all appreciated. I thank all my in-laws. They are present. My father-in-law is here, Bale of Ugubo, the Venerable John Akinola Babalola, retired. Thank you very much. And my mother-in-law, Madam Felicia Musobalaji Babalola of blessed memory, for handing over the hands of the first child and daughter, Oluwadamilola, to me in marriage. You are appreciated, Master. My appreciation also goes to our siblings, their spouses, and their in-laws, the Ayelabolas, our congees, and Olatundes. Thank you very much for being here. My journey in the field of community medicine and public health would not have been made possible but for the spirited and trusted effort of Mama Professor Adefunke Oyemade. She's seated at the back. She's well over 90 now. Mama Oyemade, thank you, Ma, for believing in me that I will make you proud. I express my appreciation to all my teachers and mentors who taught me the rudiments of community medicine and public health in the Department of Community Medicine. So they are listed on the screen. Some of them are retired, and some of them are here in the audience. So Aderoke Manoa Olumide is here at the front. Thank you, man. I acknowledge the support I received from all my colleagues in the residency program at the time, both senior and junior. I must acknowledge the vision of the ninth provost of the College of Medicine, Professor Temitayo Shokunbi, who threw open the doors of recruitment to young faculty from around 1997 and 1998. I was fortunate to be recruited as a lecturer, one at the time. Thank you, sir. I thank the head of the Department of Community Medicine, Professor Modipe Onodiako, at the time, who received me in the department. I also thank Professor Aderonke Manuel Olumide, who not only accepted me to join her in the then unit of health policy and management, but also provided the foundation and enabling environment for my professional and academic growth and development in the subspecialty of health policy and management. Thank you, ma'am. I acknowledge the support of the duo of Professor Ladele Kalen and Professor Ayuade Oduola, who supported my application for the WHO training fellowship. The then provost of the College of Medicine, Professor Azade Wale, gave me the express approval to go on this 1-year study leave. This fellowship eventually started my career path in the academic journey. I thank you all. The birth and survival of the Department of Health Policy and Management were made possible by the people who are listed on the screen. All the principal officers of the university at the time, they all listed, and the positions which they occupied. They all participated and they gave their support for the birth of the Department of Health Policy in 2010. You are all appreciated. I must mention and commend the contribution of the mother Department of Community Medicine and all academic staff members for all the positive and encouraging steps taken that facilitated the birth of the Department of Health Policy and Management. I thank all my supervisors, mentors, and advisors of my academic journey. My supervisors, advisors, they're all listed, and the different degree programs that they supervised are also listed against their names. I thank you all. I also appreciate all my research mentors and collaborators, also listed on the screen. So the long list, you are all appreciated. All our research students within and outside the department, represented by the first students who graduated in the department and supervised by then Dr. Aderonke Olumide, Dr. Mrs. Christiana Ibrahim. I thank you all, the alumni of the department, for your support, cooperation, and the opportunity of our successful interactions in supervisor-student relationships. I also thank the 8 p.m. alumni group for their support towards this inaugural lecture. Thank you. I thank the immediate Vice Chancellor of the University of Medical Sciences on those stage, Professor Adeshego Fatusi, who's also in the audience. Yeah, he gave me the platform and the full support to do all that I did at the University of Medical Sciences. Thank you very much, my brother. My colleagues I also thank my colleagues and friends and the PhD students of UNIMED, particularly the 2023-2024, for the support that you gave towards this inaugural lecture, and for a fruitful working collaboration that we had. My professional colleagues at the Federal Ministry of Health, Abuja, who engaged me on the activities of their departments, divisions, and units are all appreciated. I thank my Dean, Professor Magbagbe Oladairo, for nominating me to give this inaugural lecture on behalf of the Faculty of Public Health. I thank all the teaching and non-teaching staff of the Faculty of Public Health and Department of Health Policy and Management for all the efforts and preparations, both physical and financial, that they put together towards this lecture. I especially thank the inaugural lecture committee members, led by Dr. David Adewale. Some of them are seen in the picture, and their names, their names are listed. Thank you all for the tireless efforts that we put together in making this lecture to come a reality. I also thank Professor Aderonke Manolumide, again, Professor Odele Jagede, and Professor Ademola Juwon for their valuable review comments on this lecture. I thank the Ibadan South Anglican Diocese family, ably led by her Bishop and Mama Bishop, Reverend Akindode and Mrs. Adebola Kokola, for your continuous spiritual support in our lives. I appreciate the overwhelming presence of the members of the Lucan Archdeaconry and St. Luke's Anglican Church of the Ibadan South Anglican Diocese, ably led by the supervising Archdeacon, Venerable Lufemi Oyewusi, and Reverend Canon Andrew Olajide, respectively. I acknowledge the presence of all other clergymen and women and imams in the audience, all represented by retired Archbishop Akinyemi. The presence and support of the Methodist High School Ibadan Old Boys Association, led by Engineer Oluyemi Morakinyo, the Chairman, Board of Trustees, and Bishop Moradeyo, the National President, respectively, and all the BOT members. They're all seated over there. Thank you very much. You are all appreciated. Furthermore, the Metal Boys class of 1975-86, ably led by senior prefects of the time, Venerable Dr. Olugbenga Olagundoye, are sincerely appreciated for gracing this occasion on one of their own. I appreciate the support of my University of Ibadan, College of Medicine, BDS, MBBS, 1987 class. I must also thank the members of the community where my family resides, the good members of and my neighbors at the Okebadan Estate, Akobo Ibadan. I thank you all for the honor through our chairman, Mr. Bobby Olofa. Lastly, I want to give glory to the Lord for the members of my family. His grace and mercy have always been sufficient for us. I thank our Pastor Mide, Ayomide, and Tiwaladi Oluwa for their patience, understanding, perseverance, love, and kindness demonstrated as we strive to provide parental guidance for them. Thank you, Damilola, the love of my life, for being there. For being there with and for me all through the years of our coming together in marriage. You have been a pillar of support, a spiritual warrior, a counselor, a friend, a confidant, a sister, and a mother. To me and our children. It is my prayer that the Lord will continue to sustain our family. Mr. Vice Chancellor, sir, distinguished ladies and gentlemen, I thank you all for this honor.